A major legal challenge was launched today to protect the health of refugee claimants in this country. It argues the federal government violated the rights of refugee claimants when it cut their health care coverage. The government did it to ensure fraudulent claimants don't take advantage of the system. But as Christina Stevens reports, it's left vulnerable people without the care they need.
New here, I don't have money.
This refugee claimant from sub-Saharan Africa, who doesn't want to be identified, had to rush her fourth-grade son to a Toronto hospital over fears he may have malaria, a potentially life-threatening disease.
He was sick, he was crying.
She was handed a $700 bill, so unaffordable she couldn't take him back for a follow-up appointment to make sure he was okay.
Because when I go again, the money is going to increase.
And here is the official document.
A group of doctors and lawyers battling recent changes to interim federal health coverage for refugees say her story is yet another example of what's wrong with the system. They say under new rules, failed refugee applicants and refugee claimants from designated safe countries aren't eligible for health care coverage, even when they're still legally allowed to be in Canada.
The health care coverage for heart attacks is, and I quote, none. Same for pregnant women and their babies, coverage, none.
They have examples of rejections.
A man with a mass in his colon is denied appropriate investigations to rule out a possible life-threatening cancer. A woman with a cardiac arrhythmia is turned away from care.
They filed a court challenge arguing the changes contravene Canada's Charter of Rights.
Section 7 of the Charter protects the right to life, liberty and security of the person. The government's actions have put life and security of the person, physical, psychological, directly at risk.
Plus, they claim the new rules are discriminatory. Not so, says the minister in charge.
There are no refugee health cuts. There are changes to the program for bogus asylum claimants who have been rejected by our fair and generous legal system, deemed specifically not to be refugees.
He says the changes have resulted in a reduction of false asylum claims because the unlimited access to health care has now been restricted. Meanwhile, the doctors and lawyers say the new rules have made things so confusing, even some refugees who are eligible for coverage are being denied. As for this mother, she managed to get her bill cut in half and is paying it off $20 at a time. Christina Stevens, Global News, Toronto.